Hello, Charlie. How are you doing today?
I'm good.
Excellent. So you're here for your oral peripheral exam. Do you have any questions before we get started?
Nope.
Awesome. So the first thing that we're going to do is to take a look at your face. So I'm just going to look for overall symmetry, if there are any abnormalities. So it does seem like the side of your jaw here is a little bit puffy. Is that something you're aware of, or is this new?
Yeah.
Is there any pain or discomfort?
It clicks sometimes.
That's interesting. All right, so do you notice that at all when you're speaking, or is it at rest?
When I'm at rest.
Alright, so if you notice any pain or discomfort throughout the exam, just let me know and we can always stop and take a break.
Okay.
Alright, so the next thing I want to look at before we move on is just your spatial sensory. So what I'm going to do is have you close your eyes, and then I'm going to take these Q-tips and touch different parts of your face. I'm just going to have you tell me where you feel them touching. Okay? Alright, so you can close your eyes. Alright, can you tell me where you feel that?
That is on my left side.
Alright, what structure?
The jaw.
Excellent. And how about now?
That is on my right side on my jaw.
Alright, so I'm just going to touch both sides of your face now, and I want you to let me know if you feel any difference in the pressure.
I feel more on the left side.
More on this side here.
Yes.
Awesome, so great job so far. So I'm just going to take a look at your overall posture, looking for symmetry again. Do you mind just giving me a shoulder shrug? Alright, excellent, nice and symmetrical. One more thing, do you mind just looking to the left and the right? Awesome, any resistance, any discomfort while doing that?
No.
Excellent. So now we're just going to move on, take a look at your lips. So as always, looking for symmetry. So I notice you're breathing through your nose, that's good. No signs of congestion. Alright, no drooling, also another good sign. So now I want to just look at your lip mobility. So to do this, I'm going to have you do a couple of different things. So first, I need you to pucker your lips.
Okay.
Excellent. Now can I get a big smile? Excellent. It's nice movement. And then one more thing with your lips here. So I'm going to have you puff out your cheeks in a moment, and then I'm just going to place my hand in front of them so I can see if there's any air escaping.
Okay.
All right, so can you puff out your cheeks? Excellent. So we got good closure. So now we're going to move on, and I'm just going to take a look at your jaw.
Okay.
So I'm looking here just to make sure everything's proportional, everything is lining up. Now I want to take a look at the motion of your jaw, and the range of motion. So I'm going to have you just open and close your jaw slowly so I can get a look at that when you're ready. Excellent, so got good range of motion. And now I just want to check the strength of your jaw.
Okay.
So to do this, I'm going to have you open your mouth, and I'm going to place my thumb on your chin, and then you're just going to try and close it against the pressure that I'm pushing down. Okay? So open your jaw. Right, and now try and close it. Excellent. Was there any discomfort in your jaw when we did that?
No.
Awesome. Right, so we're going to move on. I'm just going to take a look at your teeth now. So do you mind just biting down and giving me a big smile? Awesome. So I'm going to take this here. I'm going to stick it between your teeth and your cheek, just so I can get a look at your molars. All right, what I'm looking for is just to see how they are lined up, and everything is looking very typical.
Thank
Great job. Not seeing any decay until we brush our teeth.
Thank you.
All right, now I'm just going to take a look at your tongue. So if you don't mind just opening your mouth, sticking your tongue out a bit. So awesome. So again, I'm just looking at overall symmetry, the color of your tongue. Everything looks very typical. All right. I also want to just check out the range of motion of your tongue. So to do this, I just want you to open your mouth a little bit and try and touch the top of your lip. So just like this.
Okay.
Awesome. And now can you touch your bottom lip? Excellent. So I'm not seeing any jaw movement while you do that, which is good. Want to make sure that we can move those structures separate from each other. Now I also want you to take your tongue and then move it left to right in your mouth. So just like that. Awesome. And again, I'm not seeing any jaw movement while you do that. So it's a great sign. So now I'm just going to test the strength of your tongue. So I'm going to use this stick again. What I'm going to have you do is stick your tongue out, and I'm going to press against one side of your tongue with this, and I need you to just try and push against it and not let me move your tongue to the other side.
Okay.
All right, so stick your tongue out. And I'm going to apply some pressure. Excellent. I'm just going to do the other side now. Awesome, great job. And one last thing on this part of the exam, so I just need you to take your tongue tip and touch it to the top of your mouth. So, awesome. I'm just looking at that little piece that connects your tongue to the bottom. Everything looks good. Got nice mobility there. Able to get it all the way to the top. No discomfort while you're doing that?
Nope.
Excellent. So now we're going to take a look at your hard palate. So to do this, I'm going to use my mirror here and my flashlight. So I'm going to have you open up your mouth, and I'm going to get in there with these instruments, and I'm just looking at that part right behind the teeth on the top row there.
Okay.
So open your mouth for me. Awesome. And everything looks good, nice and symmetrical, good color. I'm going to place these down for a moment. Not noticing any cleft palate. Alright, so now I'm going to take a look at what's called your soft palate. So this is going to be right behind that ridge behind your upper teeth.
Okay.
So to do this, I'm just going to need you to open your mouth nice and wide so I can look all the way back at your uvula as well. And I'm going to be using my flashlight again.
Okay.
Alright? Perfect. Everything looks good back there. Good color. So I also want to check out your nasality. So when we produce speech sounds, we tend to push the air out through our mouth, except for sounds like M and N.
Okay.
So I'm going to have you say a couple of words for me, and I'm just going to try and get a sense for your nasality.
Okay.
So the first word we're going to say is pop.
Say it?
Yep.
Pop.
Excellent. So now I'm going to have you pinch your nose and say the same word. So pop.
Okay. Pop.
Excellent. So you hear that it sounds the same.
Yes.
So that's telling me that you're not pushing any air through your nose that you shouldn't be.
Okay.
So now we're going to try it with a different word. So I want to hear you say mom.
Mom.
Excellent. Now pinch your nose and try saying the same word.
Mom.
Awesome. Sounded different. So what that's telling me is that when you're making those nasal sounds, you're pushing the air out through your nose just like you should be. And then for those non-nasal sounds, it's coming out through the oral cavity. All great signs. So we have one more activity that we're going to do. This one's a little silly. So I'm going to give you a series of sounds that you're going to have to say as fast as you can. So we're only going to do 20 seconds per sound. So our first one, for example, is going to be pa. So I'm going to start my timer for 20 seconds, and I'm going to count how many times you can say it. So for example, you're going to go pa, 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 as fast as you can for those 20 seconds. Okay? All right. And then whenever you are ready.
Pa 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 pa. Pa 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 pa.
All right, excellent. All right, so we're going to do the same thing, but now we're going to use the sound ta.
Okay.
Ta 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 ta. As fast as you can for those 20 seconds, okay?
Okay.
I'm going to get my timer set. Whenever you're ready, Charlie.
Ta 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 ta. Ta 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 ta.
All right, excellent job. And now we're going to do it with one more sound. So our last sound is cuff. So ka 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 as fast as you can for those 20 seconds. All right, you're doing a great job.
Okay.
And begin.
Ka 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 ka. Ka 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 ka.
All right, excellent job.
Yeah.
So we've got one more series of sounds. I know it's a lot of sounds.
All right.
All right, so this last one we're only going to do for 10 seconds. So it's going to be a combination of all of those sounds. So now we're going to say pataka.
Pataka.
Yep. So as fast as you can in those 10 seconds.
Okay.
Okay, so I'm going to get my timer started, and you can begin.
Pataka, 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 pataka.
Excellent. Awesome. And so that is everything. Charlie, you've done an excellent job today.
Thank
So get all of this written up for you, and then hopefully we'll get you some recommendations for your jaw.
Awesome.
And